A drug that reverses the effects of an opioid-related overdose will soon be available for over-the-counter sale in the U.S. The country faces an opioid crisis, with record numbers of drug overdose deaths reported each year. The prescription nasal spray Narcan is expected to become widely available later this year, but its cost could be a limitation. Critics also warn it doesn't address the deeper problems at the root of the crisis. William Denselow reports from New York.
It can spell the difference between life and death. Naloxone can reverse the effects of an overdose and won't cause harm to someone overdosing on something other than opioids. Outreach groups say fentanyl, a synthetic opioid up to 50 times stronger than heroin, has saturated the drug supply.
Fentanyl is in the powder cocaine, the crack cocaine. It's in the compressed pills, and it's in the heroin. Now the danger is that you have added xylazine to that mix, which is, if people don't know, that is an animal tranquilizer who's not meant for human consumption.
Many also blame major pharmaceutical companies and the practice by some doctors of over-prescribing prescription painkillers for contributing to the nation's opioid epidemic. There were more than 2,500 fatal overdoses in New York City in 2021, the most seen in at least 20 years. Officials say the figure was likely even higher in 2022. Nationwide, opioid overdoses have now killed more than 100,000 people in each of the past 2 years. Around 17 million naloxone doses were distributed in 2021 alone to help buck that trend.
Everybody needs to have and know about naloxone, but it needs to be in the hand of predominantly drug users and friends and family of drug users, because they're going to be the ones to be first on the scene if someone overdoses or when someone overdoses, so they can use it right there.
The naloxone nasal spray Narcan was approved as a prescription drug by the US Food and Drug Administration in 2015. Now Narcan has been given the green light to be sold over the counter. By late summer, Narcan will be available for purchase online, in gas stations, supermarkets and other major retailers. The FDA says it's a move to address a dire public health need. Narcan is already distributed widely by healthcare professionals and community outreach groups, but advocates hope its sale over the counter will help normalise its use among the broader population.
Before someone calls 911, if they see someone on the street, if it's a friend, a loved one, someone on a bus with them or a ferry, having Narcan available is really very, very important.
The maker of Narcan says it hopes the out-of-pocket cost for the drug will be under $50. Some fear that sticker shock will be a deterrent.
But you really need to think about saturating communities with naloxone, saturating it and making it available in low threshold settings where there are no barriers. If you put up barriers, people are not going to access the medication. So if you stigmatize people, discriminate against people, or charge them a lot of money, people are not going to access the medication.
Some argue the wider availability of Narcan is a positive step, but feel broader action and more thorough solutions are needed.
We need to have mass awareness and prevention campaigns. We need to get people into treatment. Even if they don't want it, we need to figure out ways to get them into treatment. So there's a lot of things we need to do that are, frankly, a lot harder, a lot more expensive, but would have a lot more of an impact.
Critics of Narcan argue it provides a safety net for addicts and insist that it's no magic bullet to reverse the opioid crisis. But its advocates say its broader availability is crucial to help prevent thousands more lives from slipping away. William Denselow, CNA, New York.